is Dr. Long Vo.
And who is Dr. Julie Dow?
I believe they're with Smiles Center Dental outside of Toronto in Burlington, Ontario.
We did a terrific interview with both of them for our Dental Top Doc Legends program because of the innovative work in dentistry that these folks are doing up there.
They have some groundbreaking work, and you're about to see one of the questions and answers that we asked them during our interview series. And then at the end, we have a lot more for you, so you want to stay tuned all the way to the end. Special offer coming for you.
A very special offer. Stay tuned.
This sort of sounds like a disease, the way this question is asked. What are the symptoms of teething, and what can I do about it? Now, isn't this when we go to the liquor cabinet, get a little something, and we put it on the gums?
No.
That's not the way we're supposed to do it. Okay, so I haven't gotten to that yet with my grandson, so I won't do that one. But.
Yeah. So teething is basically when the baby tooth is trying to break through the skin and come into the mouth.
Thank you.
Okay. And the symptoms are for a little bit of swelling of the gums, or a bit of blanching of the gum, because it's forcing the tooth is forcing its way through the gum. It can be a little bit painful. The child may start crying. Avoid food.
A lot of saliva.
A lot of saliva, and putting their stuff in their mouth and having a tendency to bite on hard surfaces just to help that tooth cut the gum so it can come out. And that's why cleaning baby's gum is a good way to stimulate it and speed it up, because having the tooth erupting through the gum is not very pleasant. So if we can massage the gum and push it down onto the tooth and help it cut it faster, and it heals very, very well. So I've often brushed my kids' teeth and seen a little bit of blood on the cloth, and my child is not crying, right? So to me, it's like, wow, that's a good thing, because now the tooth is erupting, and then my child won't need to go through the painful stage. And fever is not really common, but sometimes there's that misconception that maybe the fever may be due to teething. But basically, if there's any symptoms that are before 3 days, let's say, the eruption of the tooth, and then symptoms after 3 days, after the tooth has come in, those are really related to the eruption. But any symptoms that are before that, but there's no teeth coming in, then it may be something else, and you may want to consult with your physician. And if you have a question, we're here to help. So just give us a call, drop in, and we'll take a look and we'll see. But it's a natural process. So
do you ever recommend anything like Oragel or anything like that, or do you want to stay away from that?
Yeah, I'm the type of guy that avoids medication as much as possible. But of course, if there's any doubt, and if you think that your child is going through a painful stage, then consult with your physician, and perhaps a little medication can help alleviate the discomfort. But remember, it's a natural process that will happen no matter what. So whether they're in pain or not, it's going to pass, and it's the way teeth erupt, and it's just natural.
And Dr. Julie, you were kind enough to give me a little cheat sheet here, so I'm going to use my cheat sheet. There's some interesting ones here. Other sort of signs and symptoms that teething may be happening or about to happen. One that I would never have necessarily thought of is rubbing of the ears as well as cheeks. So that.
Well, it's irritating to them, so it's itchy.
So
the kids try to do something. They try to rub the ear. They try to rub the cheek. They try to take away that discomfort from the jaw, and they're reacting to it. But generally speaking, it's it should be persisting symptoms. If it's something that you've noticed the baby's been going through for more than a couple of weeks, just make sure that it's not other underlying condition.
And obviously, something like refusing food would be an important one to pay attention to.
Yeah, well, refusing food is if they're not comfortable, it's itchy, the area is tender, they may not have as much appetite. But again, it just to make sure there's no other medical condition that they could have, and it's not related to the teething, because again, teething is a natural process, so the symptoms should not be severe.
And they shouldn't last a long time.
It shouldn't last a long time. So if they have persistent fever, consult your physician. Make sure that they're not sick or have other illnesses. If you suspect the teething, again, is to make sure you wipe those gums and make sure you inspect the mouth. So do you see little swelling area where the teeth will come in. If everything looks fine, then just make sure you rule out any other causes for those symptoms.
Okay, great.
Whoa, Dr. Mark, that's a good answer there to that question.
That was terrific, but that's just the beginning. We have so much more to give you here.
Where do we have more to give you here?
DentalSecrets101.com.
DentalSecrets101.com. What do we have there?
There we have the entire interview that this was just one question from, but that's just the beginning. We have the Dental Secrets 101 special report.
Oh, you do want to get that. That's a downloadable right away. You can get all these questions and answers, some new ones, some other information.
Lots of information to take care of your dental health and the dental health of your family. But you're also going to get an ongoing newsletter with great tips for your dental health and taking care of your kids. But the interview is going to be terrific because it is just lots and lots of information with two dentists.
And every time we add another series of these, we add it to the same thing. So you may find there's a lot more there than you even think is there. So if you liked this question and answer, now's the time to get even more. So click on that link that's down below, Dental Secrets 101, and get all of this, plus so much more.